Thank you so much, ma'am. So today we'll be talking about immunotherapy in cancer management. So before that, we need to know what is chemotherapy, what is targeted therapy. Then only we will be able to understand what is chemotherapy. In chemotherapy, sorry, immunotherapy. So for immunotherapy, we need to know its immunophysiology, what is the background behind it. So coming to this thing, we'll talk about chemotherapy. Later on, we'll be talking about targeted therapy, and later on, immunotherapy. So, what is chemotherapy? It's a foundational approach. Chemotherapy is a powerful medical treatment used to fight cancer by targeting cells that grow rapidly and divide rapidly, which is a hallmark of cancer cell. So, here's how it works. First, cell disruption. Chemotherapy drugs interfere with cancer cells by hampering its ability to divide and multiply. They either damage the DNA or block the machinery needed for cell replication. Second thing is systemic action. Unlike surgery or radiation that targets specific areas, chemotherapy travels through the bloodstream, affecting cancer cells throughout the body. And it comes with a collateral impact as well. Because it targets fast dividing cells, it can also affect healthy cells like those in hair follicles, bone marrow, and digestive tract, leading to side effects. So, what are the goals of chemotherapy? For what purpose we are giving chemotherapy? That is the most important thing. So, like if our intention is for curation, like curative treatment, then it is used to eliminate all the cancer cells so they don't come back. For control, or you can say for a neoadjuvant chemotherapy, it is to slow down the growth or spread of the cancer. And third is the palliation. Palliation is like supportive sort of thing, where we ease the symptoms by shrinking the tumor that cause pain or pressure. In palliation, we do not intend to cure the patient. Coming to the next thing is a targeted therapy, which is also known as precision medicine. Targeted therapy is a type of cancer treatment that zeroes in on specific molecules or genes that help cancer cells grow, divide, and survive. Unlike chemotherapy, which affects all rapidly dividing cells, targeted therapy is designed to be more selective. It is like a sniper instead of a shotgun. So, the major difference between chemotherapy and targeted therapy is like chemotherapy is acting on all the cells, but while in targeted therapy there are specific targets, we'll be looking into it. So that targets are only we are approaching them. So how targeted therapy is working? First of all, we need to do a biomarker testing. First, doctors analyze the cancer cells for specific genetic mutations of proteins called biomarkers that can be targeted. Once a target is identified, drugs are chosen to block or interfere with that specific molecule or pathway. And third is the disruption mechanism, which blocks the signals that tell cancer cells to grow or divide. Second thing is trigger cancer cell death. Then it prevents formation of blood vessels that feed tumors and deliver toxic substances directly to the cancer cells. So these are the three basic concepts how target therapy is working. So common targets for targeted therapy are HER2, which is found in some breast and stomach cancers, EGFR, which is found in lung and colorectal cancer, BRAF, which is commonly seen in melanoma and thyroid cancers. Similarly, AL, KRAS, and BRCA mutations are found in various lung, breast, ovarian, and prostate cancers. So this, what we do in targeted therapies. Suppose if there is a case of CA lung, then we do EGFR AL cross in that patient. And if it is positive, then we can add targeted therapy along with chemotherapy in those patients. Coming to immunotherapy, like it is like empowering your own immune system. So first, what is the immunophysiology behind it? The immunophysiology of cancer explores how the immune system reacts with cancer cells, sometimes fighting them, sometimes being evaded or even exploited by them. It's fascinating and rapidly evolving field that bridges immunology and oncology. Here's a breakdown of the key concepts. First is cancer immunosurveillance. The immune system constantly monitors for abnormal cells. T cells and natural killer cells can recognize and destroy emerging tumor cells. This process helps prevent many cancers from developing in the first place. Second thing is tumor antigens. Cancer cells often express abnormal proteins called tumor antigens. There are two things, that is tumor specific antigen found only on cancer cells, that is mutated p53 and RAS proteins. And second is tumor associated antigens, which is present in normal cells but overexpressed or misexpressed in cancer. Example is HER2/neu CEA in breast and colon cancers. Third is cancer immunoediting. It is a dynamic process in three phases, that is elimination, where immune system destroys cancer cells. Second thing is equilibrium, surviving cells are kept in check. And third is escape. Cancer cells evolve to avoid immune detection and grow unchecked. So these are the three things which we do in immunoediting. Fourth one is tumor microenvironment. The area around a tumor includes immune cells, blood vessels, and signaling molecules. Some immune cells in tumor microenvironment, like regulatory T cells or myeloid-derived suppressor cells, can suppress anti-tumor responses, helping the tumor survive. And fifth is immunoevasion mechanisms. Tumors may downregulate antigen presentation, secrete immunosuppressive cytokines like TGF, beta, and interleukin 10, express checkpoint molecules like PDL1 to inhibit T cell activity. So, coming to immunotherapy, it is a revolutionary approach to cancer treatment that empowers your own immune system to recognize and destroy cancer cells, like giving your body a personalized defense upgrade. Immunotherapy harnesses your immune system to recognize, attack, and eliminate cancer cells. Rather than directly killing tumors like chemotherapy or targeting specific mutations like precision therapy, it empowers or re-educates the immune cells to do this job. Your immune system constantly surveils tissues seeking out abnormal cells. Cancer cells, however, evolve ways to hide tumor antigens so T cells can't see them, exploit immune checkpoints, which are natural breaks to turn off immune attacks, create an immunosuppressive microenvironment with regulatory cells and suppressive cytokines. Immunotherapy reverses these tactics, restoring or augmenting immune function. How it works? First is immune activation. It boosts or restores the immune system natural ability to detect and eliminate cancer cells. Second is checkpoint inhibition. Some drug blocks proteins like PD1 and CTLA4 that cancer cells use to hide from immune cells, allowing T cells to attack. Third is cell engineering. In therapies like CAR-T cell treatment, doctors modify a patient's own immune cells to better target cancer before reinfusing them. Fourth is cancer vaccines. Train the immune system to recognize specific cancer markers and respond aggressively. So, types of immunotherapy. First is checkpoint inhibitors. They unleash immune cells by blocking inhibitory signals. T cells normally have inhibitory checkpoints. Examples are PD1 and CTLA4 to prevent autoimmunity. Cancer exploits this to shut down immune responses. Drugs like nivolumab or ipilimumab block this pathway, reinvigorating T cells to kill tumor cells. Second is the CAR-T cell therapy. It is genetically engineered T cells to target cancer. T cells are extracted from the patient, engineered to express synthetic receptors, which are called CARs, that recognize tumor-specific antigens like CD19 in B cell cancers. These supercharged T cells are expanded in lab and then reinfused, offering a precise tumor targeting. Third is monoclonal antibodies, lab-made proteins that tag cancer cells. These are tailor-made proteins that either directly attack cancer cells, second, block growth signals, or third, recruit other immune cells to destroy the tagged cells. Example like antibody dependent cellular cytotoxicity, like which are the drugs trastuzumab is used in breast cancer for HER2 positive patients. Then cancer vaccines. It stimulates the immune response against cancer antigens. Unlike preventive vaccines, these are the therapeutic. These are therapeutic. They introduce tumor antigens to immune system, training it to recognize and fight cancer cells. They boost antigen presentation and T cell priming. And fifth is the cytokines. They boost immune cell activity. Interleukins and interferons are used to amplify the immune response. They help expand T cells, activate NK cells, and increase antigen presentation. However, systemic effects can be intense, so dosing requires precision. So, bonus concepts like tumor microenvironment, immunotherapy also attempts to reprogram or penetrate the suppressive environment created by the tumors. Second is the biomarkers, PDL1 expression or tumor mutation burden (TMB) helps predict who responds well to immunotherapy. And third is the combination therapy, like pairing immunotherapy with chemo, radiation, or targeted drugs can improve efficacy and overcome resistance. So, what are the benefits and limitations of immunotherapy? So, benefits are like potential for long-term remission, like memory T cells, high specificity, can spare healthy tissue, and limitations are only effective if the immune system can infiltrate the tumor. Risk of autoimmune side effects like colitis, rashes, and third is tumor may develop a resistance, which is why immunotherapy is not universal. It works best for cancer with strong immune visibility. Example like in melanoma and lung cancers. The future, the combination therapies. Combination strategies pairing immunotherapy with chemotherapy or targeted agents or radiation are showing promise by enhancing antigen release, remodeling tumor microenvironment, and overcoming single agent resistance. Thank you. So, basic difference between chemotherapy, targeted therapy, and immunotherapy is like in chemotherapy, it is acting in all the cells which are rapidly dividing. In targeted therapy, we are targeting specific targets like HER2, EGFR, ALK, ROS, and immunotherapy, we are doing immunomodulation. So, we are promoting our own immune system to fight against the cancer. So, this is the basic overview of all these three modalities in medical oncology. If anybody is having any questions.
Sir, this one is a question regarding this. Last time we discussed about this immunomodulator, right, for non-Hodgkin lymphomas. How does it work? Because it gives a drastic result I have seen.
Yes. So there are two ways. Like what we can do is we can directly use immunotherapy drugs or targeted therapy drugs like rituximab we are using. And second is CAR T cells, that we take out the T cells, we grow them in the lab with the specific carriers. So, and we then again reintroduce it into the same patient. So they act specifically on that cancer cells only. That is the latest thing what is happening in medical oncology, CAR T cells therapy.
Sir, how many PET scan you can do? What's the patient want PET scan?
So
what is the?
There is no guidelines that how many PET scans we can do, but it is not recommended to do very
Some say
often.
10 per year.
No, no, 10 is too much. So that is almost one scan in a month, roughly.
One scan.
No, that is not recommended. At least there should be 3 to 4 months of gap, if at all it is required. We should not do it very regularly because there is a lot of exposure of radiation, even the dye or FDG what we are injecting. So at least we should wait for 3 to 4 months. If at all there is some dilemma in decision making, we can repeat once for the sake of what we can decision making or something, but it is not recommended that we do it very regularly.
So some say in my case, epstein-barr virus transmits through that Kharde, ICG Kharde. They don't transmit it.
कुठला?
Epstein-Barr virus.
I am not sure about
some,
it.
Some good radiotherapists are saying oncologists told me this.
It
Because
may
that
be,
is not boiled
but
properly, and that is the one. मी आज हिस्ट्री कोई पेशंट इस मी खरंच खातोय म्हणून. I don't know.
But that
This is not documented, but that is just-
Curvus is like colostrum, which like promotes your immunity. But I don't know whether Epstein-Barr is transmitted through it or not.